battle COVID-19, but what do we know of his progress, his contacts, and current concerns? Sharp Steely Medical Group's Dr. Abby Olulade joins us now to shed some light on this. Doctor, thanks so much for joining us this morning. We really appreciate it.
Thanks for having me. It's good to see you both.
So what can you tell us, Dr. Abby, about the president's treatment plan here? So dexamethasone and remdesivir. My understanding is those are for patients with severe symptoms, yet the White House has said the president is showing just mild symptoms. What can you tell us about this treatment plan?
Well, you're exactly right, Eric, in that, this is a sign that he may have severe illness. And dexamethasone is a steroid that is, typically given in the later stage of this illness, which is when the inflammatory response is hyperactive, and it's given to patients that may be on a ventilator and or requiring supplemental oxygen. So, it's a sign that, this is not a mild case of illness. And the medication remdesivir, it's a medicine that's IV. It's an antiviral that prevents multiplication of the virus. And it's, again, given in the setting of someone who has been hospitalized. It tends to be most effective in these cases. So, this is, a sign that, he does need to be monitored and watched.
We've heard about, the combination of the Z-Pack with hydrochloroquine. I know we're throwing out a lot of names. Is that also part of what he's doing as well to help us understand?
So, this is something that is not FDA authorized or approved. The hydroxychloroquine and azithromycin, it's not recommended as part of this treatment. The authorization that the FDA gave was revoked because evidence showed that this was not something that was effective. And so we're not going to hear that this is being used. The ones that we mentioned before, the remdesivir and dexamethasone, these are things that are, given to patients and are standard treatments that we would expect patients that are severely ill to get. You want to give the remdesivir earlier and the dexamethasone later in the course of illness. And then we also, of course, heard about the monoclonal antibody that he was given initially. This is essentially, it contains the proteins, antibodies that fight off the infection, and it's essentially given to help to augment the immune response. It's different from the convalescent plasma, but somewhat similar. The monoclonal antibodies are made in a lab, and so they're engineered essentially and may have an advantage because they have more of what we call neutralizing antibodies. But again, this is something that's not even FDA approved or authorized. It's still in clinical trials. We're unsure as to the efficacy in the context of COVID. So this isn't something that would be given to the average person, and it's definitely not widely available.
Doctor, the president's getting some criticism for taking that ride there. We saw it in the video, waving to supporters outside the hospital there. Did he put the Secret Service agents inside his vehicle at risk? I mean, as you know, that's an airtight vehicle they were in, and they were very close to each other. Again, they were wearing masks, but still, I mean, the optics of it, did that put them at risk?
Well, anytime that you are known to have an infection, there is a chance and a possibility that you can spread it. And based on what we know from the CDC, non-essential travel is not recommended when you are supposed to be self-isolating, which is distinct from self-quarantine. But, you're supposed to self-isolate when you have an active infection. So, of course, there's always that risk that when you come into contact with someone who has an active infection, that you may get infected yourself. Wearing masks, the person, being infected wearing a mask, may potentially reduce that chance, but there definitely is a possibility.
Dr. Abby, this is a big lesson for many people that COVID does not discriminate. Anyone can get it.
Right. Absolutely. Nobody is immune from this. I mean, from getting this, and it's important that we continue to take all these measures to protect ourselves from it. It's an invisible virus, and just because we want to wish it away, it doesn't mean it's going to go away. We're seeing that cases are rising in several states. So it is a big lesson for everyone.
We keep hearing the different timelines on quarantine, whether it's 10 or 14 days. In this case, it's a big deal whether it's 10 or 14 because there's another debate coming up. So how long does the president need to be in quarantine, and how quickly could he come back if he's able to bounce back, which we are all hoping for from the virus here?
So, the concepts of isolation, quarantine are a bit different. When you self-isolate means that you are separating yourself from others because you already are known to be sick. So you're displaying symptoms and you've had a positive test. But quarantine is essentially when you don't have symptoms and you have not gotten sick yet. So you are separating yourself on the chance that you may get sick. So when someone, is hospitalized with COVID and they have a severe illness, they can actually be contagious for up to 20 days potentially, not just 10 days. It can be a bit longer than that. And there is criteria that is used to determine when it's okay for them to, go back into the general population. So that is something, of course, that they're going to hopefully be following. So, it could be up to 20 days, in some cases longer. So that's something to think about.
All right. Great information, Dr. Abby. Thank you so much. We'll be checking in with you often to see, what happens, and hopefully the president does recover. Thank you so much.
I hope so, too. And congratulations, Stella, by the way.
Oh, thank you.